Psychology Forum, and I'm absolutely delighted to introduce today's speaker, Ms. Tiffany Woods. She is a wife, mother of 3, trans woman, longtime barrier LGBTQI advocate, community organizers, and is recognized local, state, and national as a local, state, and national leader. As current program manager for Transgender Services at Tri-City Health in Fremont, she ensures that trans community has access to affirming, responsive health care, HIV prevention and care, and the program she co-created in 2002, TransVision, is nationally and internationally recognized as a primary health and HIV program for gender non-conforming people in Alameda County. She made political history in 2016, being selected as an at-large delegate for Hillary Clinton at the Democratic National Convention, one of the first 3 trans delegates to ever attend the National Democratic Convention. She is a graduating member of Emerge California class of 2017, and she was recognized by Representative Ro Khanna with a Congressional Citation of Honor. So please welcome Ms. Tiffany Woods. She's a co-worker of mine. She's a great person.
Thank you, Patrick. You're so Patrick. That was a whole lot we have to get through. So thank you for that wonderful introduction that I wrote myself. I'm honored to be here at the Commonwealth Club. This is really cool. I gotta tell you, this has been a long time coming. When we started this program and the work in Tri-City Health Center in Fremont for our trans program in 2002, we started with 15 hours a week and $20,000. I was making more money casting movies in Hollywood, and my wife was like, "You should go get that job because we're never moving to Hollywood." I'm like, okay, we'll go do this. 15 years later, I think we're saving lives, we're giving hope, and we've touched a lot of people along the way. So, what I'm going to do, Trump, when Patrick came to me and he said, "I hate Trump, and I want to do something, and I hate what he's doing in the trans community," I'm like, we can talk.
I might have used different words than that.
Okay, maybe different words, but I said I hate Trump in my office and the door was closed and nobody was recording us. So, what we want to do is really talk about what's going on with transgender rights in the era of Trump. And so we're going to do 2-fold part. For trans people, we get this all the time. We get the barrage, right? Almost every day you open up whatever social media platform, news platform, and there's something he's doing. It may not be full headlines like the trans veterans now, but he's doing something. What are we doing about it? Well, of course, we have ACLU and Transgender Law Center and National Center of Transgender. There's tons of national advocacy organizations fighting this at every class, but we don't realize the scope of it until you actually just look at it. And let me tell you, after me putting together this presentation for the last couple weeks, I think I need my own therapist in mental health just to whoa. Because it's really breathtaking of the targeting of people. And it's almost surgical precision. So we're going to walk you through, and part of the way I wanted to design this was you actually are going to get a taste of what we get, of how it is affecting us mentally. And then when we get through that, we're going to breathe, and then we're going to see what we're doing at the local level Tri-City. And what we've been operating in a conservative environment for a very long time. In 2005, I was getting death threats. So this is nothing new for us to operate. We got really a little bit more visible in the Obama administration in 2014 and the Affordable Care Act. And now we know how to kind of work these waters and navigate it. That doesn't make it any better, but it's something that we have expertise in. So I'm going to go ahead and start this because there's a lot of content, and I'm going to run through these slides rather quickly to get through them all, and then we'll have a Q&A, and I'm more than willing to answer all the questions. So I'm going to open on a positive note. The World Health Organization. Note, this did not happen in America. This happened on the world stage. And if you didn't see this on June 19th, this is a game changer worldwide. It's going to take a while in America for this to take effect. But the World Health Organization said that gender congruence is not a mental disorder, acknowledged that classifying it as such can cause enormous stigma for people who are transgender. Well, this is what we've been saying for a long time. We're not crazy, we're not a mental health disorder. And apparently the World Health, finally in 2018, have agreed with us. So this is a big deal. So I'm going to open with this. As you can see, being transgender is not a mental illness. Not a mental illness. Okay? No longer is considered gender incongruence. Not everybody has it, but it's there. Condition experienced by some trans people. United Nations Health Agency announced on Monday the condition as gender dysphoria has been reclassified as a sexual health condition. And the bigger implication right now is that this announcement won't immediately impact any of the cases or health care in the United States, but has the potential to create deep and meaningful long-term changes to how transgender people are treated by the law and healthcare companies. So, while we're regressing and losing our civil rights in America, there are some really great stuff happening around other countries and on the world stage. And so it helps us to focus on that and to hold on to those and point to those as we're fighting our regression. And I was actually in Guatemala last July doing some international work with CDC International, and they were like, they're mad at us for losing all these rights that they've been fighting, modeling their rights, and fighting, like, they're doing this in America, why can't we do this? And they're getting name changes, and the government's paying for hormones, and we're like, so they're kind of like getting mad at us when we go there, and they're like, look, I got nothing to do with it. So what's happening here is affecting them as they're fighting there and using us as a model the last few years, and now it's really affecting how they're doing things, because if we're losing our rights here in America, what's going to happen there? How much hope do they have to fight what they've been fighting for? So it does matter what's happening here. And then here we go. I think we can all we're going to go back to a few years ago, and this is what was going on with all the crisis lines. Trans Lifeline is actually here in San Francisco. They had a record amount of calls that day. A record amount of calls. So are these calls valid? Are these stressors valid? Trump's weight causing a surge in demand. Mental health, this was all the way around in many different categories, not just trans. Mental health. These are actually headlines pulled. Crisis and suicide prevention headlines. Record number of calls. Trans Americans fear for safety after Trump win. We're traumatized. So this is the mental health 2 years ago. These are words out of the trans community's mouth. National trends, anxiety, stress, and fear. More discrimination, more harassment, more violence than ever, and many of the quotes that I was reading from trans people being interviewed around the country. Fear that we're going to lose our gains, especially access to trans-related health care. Hormones is HRT, gender-affirming surgeries, mental health treatment. All covered under the Affordable Care Act starting in 2014. Before that, they had never been covered. It was a game changer. People were actually improving their quality of life, they were accessing the surgeries, they were accessing mental health, they were finally being able to do the things they always wanted to do transition-wise. So yeah, we're afraid that we're going to lose it. ID documents, federal guidelines changing. What a lot of people don't realize is that quietly, between 2010 and 2012, Secretary Hillary Clinton, which is Secretary of State, quietly ushered in changes in federal guidelines for changing passport. You no longer had to have proof of medical transition through surgical procedures. That's huge, because not everybody wants surgery. Not everybody can afford surgery. It doesn't always work in everybody's life. So all you had to do was the medical documentation, but not surgical papers. Didn't get a lot of fanfare because they didn't want the conservatives and the right wings to grab hold of that during a coming up political year. And that's been the federal guidelines now. So you don't have to have the surgery. If we're afraid, and we're starting to see some changes in that unofficially. And then transition surgery ID docs timelines. Everybody's been moving up, and we felt it locally in Tri-City Health Center in Fremont. We'll get to our program later at the end. Our clients are stressed out and moving up all their timelines. I wasn't going to do the surgery, but I got to get it now. And we're like, no, you should get it now. Let's get all your referrals in now before things happen. Because it would take about a year for everything. We figured out from inauguration, it would take at least a full year for things to really start moving. So we've been pushing everybody to get their referrals in, get their medical appointment, get everything lined up, and get what you can get done while it's covered. And there's your headlines right there. Race to finish paperwork, including minors that are being, this is these two twins, one's trans. They're trying to get ID documents together. Using this one. Now we're starting to see some of that happen. Some of these are isolated cases. This just broke. Some of these are isolated cases. I will actually tell you, to get my passport for Guatemala, I had not ever had a passport because I wasn't traveling. So and we do this for a living, so I know exactly what to do. We had the medical doctor of transition. We had name change court, which I changed mine in 2004. Birth certificate, sent it all off, paid the extra $100 expedited. Got delayed. And this is before everything's really started happening. Came back. They wanted my 2004 notarized and signed court document. They wanted it updated to 2018. What? Go to the Hayward courthouse. She said, well, are you kidding me? She said, this is a perfectly legal document. She had no idea why they wanted a new one. Had to pay an extra $50 for them to just basically print it out again and stamp it in 218. It cost me an extra $50. Caused a huge delay. Why? Nobody knows. So it does seem like they're making things harder on purpose, and they're scrutinizing their documents more. We're getting a lot more calls from DMV and feds going over all of our medical doctors' numbers, their PA numbers, and really they're looking them up and they're making sure they're valid more than they ever did before. And they should be doing their due diligence, but it seems like we're getting more and more clients calling and saying, no, they're not accepting this. No, you got to change this. No, you got to add this word. So we're expecting more issues coming down the line. Hate crimes. Were these concerns valid? Well, hate crimes are up, spike. This is hate crimes, all hate crimes. 897 reports recorded in 10 days, according to the Independent. 10 days. It was 10 days since election. Okay? Hate crimes, San Francisco just broke, July 18th. We're up in San Francisco and California, according to the latest statistic. In the red is LGBT and trans-related. Incidents motivated by sexual orientation, bias, real or perceived, increased by 18.8% in California more than race-motivated hate incidents, which rose by 16%. Anti-trans and anti-gender non-conforming, a 7% increase. This is also following national trends. So all of this is in red. Hate violence. Well, we know that it's always up around the LGBT community. These are the latest stats as of 18. They don't have 18 stats. They won't have them for another year. But for 17, the first year that Trump was in office, this is where we're at. 86% increase in hate violence, homicides in the U.S. last year. 2017 was a deadliest year for the LGBT community. So it's not just fears and rhetoric. We're actually now seeing it in real time happening. And this is a coalition of 40 community-based anti-violence groups based in New York that compile this every year. It's a great database of most LGBT organizations. They're the go-to source because they have more up-to-date data than the FBI hate crime statistics because a lot of people don't report to law enforcement. The other thing that wasn't in my introduction, I'm the LGBTQ liaison for the Oakland Police Department. So I've been working with them since 2012, since we had a murder in Oakland, and I'll tell you about that later on. So, and then when I talk to them, nothing has broken yet in Oakland worthy of hate crime and violence, but we're always vigilant on it. Trans murders, are they going up? Yep. 25 and 16, 28 and 27, which was the highest and the deadliest year, and we're at 16th right now. So is the potential to top last year's totals. These are the latest trans murders. It's important. Are they targeted because they're trans in the Trump? Hard to say. No matter what we do is we're tracking them, but the fact is that they're happening and they're increasing. And most are young trans women of color. So, this is where it gets really real. From the moment that Trump was sworn in, we've been erased from the White House. This is both trans and LGBTQ. Erased from the White House, Department of State, Department of Labor websites, and he's been targeting us ever since. Legislating and erasing LGBT Americans, specifically targeting transgender Americans, out of existence at the worst and second-class citizens at the least at the federal and state level. If we can't navigate society safely from point A to point B, we can't leave the house. If I can't go to the bathroom somewhere between point A and point B, I'm not going out. And this is what we think is happening from all the reports all over the country on the ground and organizations that are actually interviewing witnesses and stuff. This is literally a targeting and trying to erase, specifically starting with trans people and then following with LGBT. According to GLAAD, Gay Lesbian Association for the media organization GLAAD, Trump's first year in office, there were over 120 anti-LGBTQ bills introduced in over 30 states. They've been waiting for this moment. They've been planning this. So let's look at all the areas that they're targeting us. Education. So the big news with the beginning of his administration, the transgender guidelines were completely removed. The historic Obama guidelines on trans students. They were historic, life-saving. They removed them. The guidance presented best practices from schools across the country and advised schools on complying with case law under the Title IX sex discrimination law. They announced that will somebody dismiss complaints from trans students. So I highlighted the trans stuff in red just so that there's a lot of content up there. You can really see it. So they didn't waste no time with this, right? Inauguration is January 20th. This is February, and we're already attacking trans students. Okay, dismissing complaints. Big news, here's the Obama guidelines that literally happened in October of the year before. Trans students must be permitted to use bathrooms that align with their gender identity. Emphasize students' gender identity will be considered that student's sex when it comes to enforcing federal law. Locker rooms, bathrooms, all gone now. The swipe of the pen. Sessions in DeVos. Schools now have no guidance for the federal government to ensure equal opportunity and protection for hundreds of thousands of trans students. Who are the most vulnerable? Youth and trans students are the most vulnerable in the trans community. We know that. Those of us on the ground, I know that some people here are working with trans students, some have in their family. They are the most vulnerable. So imagine what these headlines have done to them, right? Because they're literally seeing these headlines. And when I've talked to our clients at Tri-City, they're like, yeah, we see the tweets, we see the headlines, we see, on our Facebook or our Instagram. So when you see that, it's such an just a kind of a battering ram at you on your screens, it affects your mental health. So everybody is stressed out. And then there's HB2. So I'm going to walk you through really cool through HB2 because this is important. Because part of the federal guidelines for the trans students was around the bathroom usage. And we know that HB2, which was huge news, was a big deal in influencing and targeting this legislation against us. It abandoned its rest. So HB2 had been challenged by the Department of Justice, and a lawsuit was filed, and now it's been abandoned. The Department of Justice and Obama sued North Carolina and said it's unconstitutional to restrict the rights of transgender people using the bathroom. Obama administration and Sessions said, oh no, we're not going to defend it, we're pulling the lawsuit. Basically saying, that was unheard of. Administrations do that, they flip, but not that severely. So they left those lawsuits basically open. The Justice Department abandoned its historic lawsuit. So this is a big deal, and this is big because it has huge implications. So there's the backlash over North Carolina that we saw nationally. Everybody pulling out and saying, fix this, restore these protections, otherwise we're not having NCAAs not come in, we're not going to hold these sports events, we're not going to hold these concerts, right? Everybody, we all knew about that. So did that work? Well, yes and no. HB 142, known as HB 2, doubles down on HB 2. So it was repealed, but then they watered it down, but it still left a discrimination against about 45,000 North Carolinians into law. They still can't use the bathroom of their gender identity. We've actually had several clients from North Carolina relocate. We call them refugees from North Carolina. Refugees from other American states, only in America. And they've actually we don't want to be there anymore. They're and they had no place to live. They literally fled here, staying on people's couches. But they're here, and they feel safer. So this is still standing. And that lawsuit alleged that HB2 violated the federal law. Not only did it violate Title IX, Title VII of the Civil Rights and Civil Rights Act, which prohibits discrimination in employment, and the Violence Against Women's Act, which prohibits discrimination DOJ-funded program. Remember, the government had challenged that, and now they abandoned it. HDB 2.0 continues to be challenged in separate cases by Land Illegal, American Civil Liberties. I love this quote here, because she says here, Lily Carrillo, an incoming 24-year-old journalism graduate, says her therapist saw her therapist for the first time in months because she was getting so stressed out by the public debate around the law and which bathroom to use. You gotta have a bathroom selfie these days if you're trans. Seriously. So I was in a layover in DC. So I'm in the Charlotte, North Carolina. I had planned this thing for 24 hours. Conference, what conference? I want my selfie in the bathroom, North Carolina. Come and arrest me. And that's a good picture too. That was the fifth one. I was that's crappy. No closer choice. No. Who finds a selfie in a bathroom? That's what we're doing now. You know, we're not like the safety threat that you think we are. We're actually trolling the perfect selfie so that we can post it on our social media platforms and going, look, I'm in a bathroom. Anyways, yes, so in 2017, 2018, your takeaway is a trans person taking a selfie in a public restroom is an act of revolution. How did we get here? Really? Okay, look at that again. Okay. Primer on bathroom bills, really quickly. This is a little bit, we call them the bathroom bills. 16 states, as of 2017, modeled after HB2, which at that time had been the only one that had passed. 16 states had all had these planned, including Texas. I was actually in Texas last June when they were debating it. I was training the public health department. That was fun in session. When the public health department, the epidemiologist, prevention, and we were that came up as far as we were talking about pronouns and bathrooms and everything. And the point is, if you're doing all this from just public health point, if you are training your public health department staff on gender identity and pronoun usage and who's identifying as who, and these are your clients, and you've got all this funding out in the community at your public health clinics, and you're all ready and you're training all your staff on what's the proper, this is gender non-conforming, and this is what it means, this is what they means, and this is what, you know, how she or he identified. You're right, you're trying to do everything right, so we don't offend, and everybody's ready on pronoun and everything, and ready to serve, and take their proper sexual orientation and gender identity data, and you're waiting for them to come in, and all your trans folks are sitting at home because I can't go pee, and I have to take public transportation for 3 hours to get from point A to this clinic and then get back, and I can't pee because it's against the law. They ain't coming. You can do all the prep work. They're not coming to your clinic because they can't pee safely. So let's talk about urinary tract infections. Let's talk about other health issues because you're holding your pee all day or you're holding it for hours on public transportation. That's wider impact and public health impact of these bathroom bills. They're insidious. And that's what they're targeted. Their target is to keep us at home. If you can't navigate point A to point B, like I said earlier, safely, you're staying at point A, wherever point A it is. All right, let's look at justice. So we already have lawsuits being abandoned. This was canceled. Transgender persons in custody, a legal landscape. That was long planned and canceled. Bureau of Prisons. A legal policy of almost entirely housing transgender people in federal prison facilities that match their sex assigned at birth. You're housed by genitalia, no matter how much transition related you have. Got a penis, you're sitting in the mins. Even if you have full breasts, hormones, everything. That's one of the big things that a lot of people are not aware of. And that influences federal policy down to state and local levels. So that's going to affect our policies, maybe not in the Bay Area, but in other states. June 4th, Department of Education withdrew its funding in the Ohio School District discriminating against a transgender girl. The department gave no explanation for it. No, they just withdrew it. Court goes, okay. The reason why I'm reading from there is because I didn't bring my glasses because I'm really vain and I love this behind me, and so that's why I'm reading that. I can't see the screen. And it's more fun than to walk around. Justice Department, July, a year ago, filed a legal brief on behalf of the U.S. in the U.S. Court of Appeals Second Circuit, arguing that the 1964 Civil Rights, this got a lot of play, does not prohibit discrimination based on sexual orientation or implicit gender identity. Almost every other administration had said it did. They broke, and they're saying it doesn't. So many lawsuits are attacking this now. This is a big deal, because this affects not only trans students, youth, women, teenagers, young girls. This is all being identified, interpreted completely different from the Obama administration and even the Bush administration. Department of Housing, HUD. If you understand the economics of trans reality, low-income housing is almost the only things that a lot of young trans people and older trans people of color are basically accessing. Whether it's SRO hotels, Section 8 housing. HUD had passed in 2016, I believe, or 2015, the Obama administration had passed sweeping guidelines removing discrimination to LGBT in HUD housing. Game changer, especially for HIV positive, African American, Latina, low-income trans people. They now can't be discriminated. Now they can. That's what they're moving for now. Removing all the guidance in the key resource documents and best practices for housing. So we know that they're moving to eliminate our housing. Legislation. Kansas is fun these days. Dorothy ain't in Kansas anymore, let me tell you. The entire platform says that every step of the way, trans people in the state of Kansas, including youth, children, will not be validated in their transgender identity in any medical setting, any school, in any environment at all. And this is called, it was called the compassionate view. Compassionate, because they think that they're being compassionate because there's no such thing as transgender identity, and we don't want people to be misguided in that. And so we're here to help them and say that they're not. The whole state. This was the Republican platform plank. How many GOP states, red states, are going to follow that? I know, see? You're all like, really? Really? I know, this is what we do. Do you want to know what the trans mental health is? Here we go. This is a little window. And then we have the famous tweets. I know, this was hard looking at these tweets on my computer that hard, but the famous, infamous ban trans military, which has now had 4-court challenge and is still deemed unconstitutional and cannot be enacted. So I don't have time in this limited form to tell you all the actions against these, but no, all these actions are because of this. Every action is reaction. So these are the trans military ban for really no reason. We now know the reason it was a bunch of conservative Republicans that had actually got mad because they went to Mattis and they wanted a ban, and Mattis said no, so they went around Madison and went to the White House and they had a meeting with Trump. Vicky Hartzell, who is a Republican conservative congressman, I believe it's Oklahoma, was the leading charge of this. And she's virulently anti-trans, not anti-gay, anti-trans. Reaction to this, here you go. Fired by a tweet, imagine. Captain Jacob Elizer, 31, who serves in the Kentucky Army National Guard, took the day off from his job as a therapist in Lexington to figure out the situation. Fired by tweet. That was honestly pretty shocking. Rudy Akferon is 26, said he would not leave the armed forces. I'm just serving as a soldier just like anybody else. His chain of command was supportive of him as he transitioned from female to male. Everybody's hurt, everybody is scared. This is people's lives. We're talking about people who enlisted nearly 20 years ago, and now 18 or 19 years in, now it's being taken away and they don't get to retire. 4 legal challenges, and this is now still considered unconstitutional and not being administered yet. But they're going to keep fighting it. So imagine reading these tweets and you're like, your pension is tied up into that, your whole service career on a tweet. Employment. Yep. Sweeping discrimination. I'm over here because you guys are like all alone over here. Like, I didn't talk to you. Come over here on stage with me. You guys are holding it down over here. Employment. Implicitly gender identity. Businesses to discriminate on the basis of sexual orientation. Okay. October 5th, Justice Department released a memo. Just a memo, but it instructs Department of Justice attorneys to take the legal position that federal law does not protect transgender workers from discrimination. He just really likes us. It's like, hey, where we can get that transgender word in there, right? October 6th, Justice Department releases sweeping license to discriminate, allowing federal agencies, government contractors, government grantees, even private businesses to engage in legal discrimination, as long as they can cite religious views. And healthcare again. This is all about the Affordable Care Act non-discrimination protections for trans people. Prevents HHS from taking any action to force trans people's rights from healthcare discrimination, so we can't complain, we can't file a lawsuit. May 2nd, announced a plan to roll back regulations determining non-discrimination prevention. So they actually went after us first before the rest of y'all. We're at the front of the line. Y'all gotta get behind us, okay? And then when they get done with us, it's coming after you guys. All right. And then the infamous CDC words. I'm a banned word. Janet's a banned word. Lorena's a bad word. Erica's a bad. Can't say transgender anymore. Actually, during the Bush years, when we were doing HIV and grants and stuff around 2010, no, before, about 28, those who work in HIV, we started hearing a congressional investigator, several congressional Republicans, anti-gay, were literally pulling any grants that had the words gay, MSM, anal sex, transgender. They might have had 2 years left of their funding. They were NIH grants, they were CDC grants, they were HHS grants, and they were all pulled and notified of the